We'll go ahead and get started. Hi, everyone. This is Lola. I'm the coordinator of the Harvard and Beth Israel Deaconess Medical Center site for the New England MHTTC. Please feel free to introduce yourself in the chat box if you'd like. And now I'll just review a few housekeeping items before we begin. So participant microphones will be muted at entry. If you have questions during the event, either technical or content related, please use the chat. This session is being recorded and it will be emailed out to all participants once it becomes available. It will also be posted on our website. If you have questions after the session, please email newengland@mhttcnetwork.org. At the end of this month, we'll send a certificate of completion that you can submit to your particular board for continuing education credit. If you have questions about CEs after the event, you can email ifisher@c4innovates.com for more information. This is an MHTTC acknowledgement slide. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and lastly, consistent with our actions, products, and policies. And with that, I'll hand it over to Shirley to introduce our presenter for today.
Great. Thank you all for joining us. It's my pleasure to introduce Dr. Raul Candamaran, who is a practicing psychiatrist at Massachusetts Mental Health Center. He studied chemistry and international medicine in Peru. And Dr. Candamaran founded and directed a medical center in Peru that served a population of 30,000 people. He was the director of the tuberculosis program for many years. He's board certified by the American Board of Psychiatry, Neurology, and Psychiatry, Addiction and Psychosomatic Medicine, and a diplomat in psychoanalysis. Dr. Candamaran also did a fellowship in HIV psychiatry. He's an instructor in psychiatry at Harvard Medical School, and he's on the editorial board of the American Academy of Psychodynamic Psychiatry and has written some articles about non-adherence and psychodynamic pharmacology. Dr. Candamaran was a member of the Transcultural Psychiatry Committee and co-chair of the annual meetings of the American Academy of Psychodynamic Psychiatry in Toronto and San Francisco. Dr. Candamaran, thank you so much for joining us today and presenting at our Grand Rounds.
Thank you, Shirley. Thank you, Lola, for the presentation. Today, we want to discuss and talk about transcultural psychiatry. This is a broad subject, a very broad subject, and I'm going to try to focus mostly in things related to the majority of patients that we have in here. We have a big minority, a mass mental, for instance, and with a big Hispanic population, Haitian population, Central American. So this part of the transcultural psychiatry is going to be, in some point, mentioning this group. So the audience, the clinicians, or everybody have a little more knowledge about this population that we serve for so many years. Next. What is the importance of transcultural psychiatry, or also called cross-cultural psychiatry or intercultural, because it's very dynamic? It's, one of the things, like for instance, in 2007, it was estimated that 191 millions was at that time, 3% of the world population was migrated. That increased to 155 million in 1990. And in 2020, the people who migrate, is around 281 millions. And here in America, one of the countries who received the most is the United States. And they basically we receive from different countries, different cultures, but basically the most are from Mexico and Central America, especially in the last 20 years. No, another country who have big variety of the migration and have a good program in transcultural psychiatry is Canada. Next. Just basically to start is a practical application in terms of cultural psychiatry is since sometimes we don't know much about the culture, would be good to start it to interview the client with open-ended questions, not to have the broad idea what they are talking about. And we need to identify issues in terms of ethnicity, religion, what is the socioeconomic background of the patients, the level of instruction, education, even migration and legal status that can help us understand the dynamic, what is going on with the patient in terms of stress, anxiety, also, we want to discuss later about the idioms of distress, idioms who are cultural bound. Try to be in our interview very open-minded to listen, to try to understand. Sometimes it's not too easy, and to ask questions for clarification. Next. Basically, I want to try to, rather than reading what is exactly in the emails, sorry, in the PowerPoint presentation, I want to do some comments, regarding the slides. One is, for instance, is important, and it's very, very important when we do cultural psychiatry, for instance, in the assessment and treatment of the children and youth. But they are in charge, the children and youth, they live in a bicultural world. Sometimes they were born here, or they come very in early age, and they become bilingual, but bicultural too. So many times, the parents there could be only Spanish speaking, French speaking, Creole speaking, or any languages, and also they are raised or taking care of the grandparents, who pass the culture to them. It's important also to check, and we want to discuss later, the importance of the relation between religion, spirituality, and mental health. Cultural and ethnic issues in terms of psychopharmacology that I presented once last month, and the importance of assuming the cultural things. Like I mentioned, I remember at the time, for instance, for the Latino population, other people, to start it is in terms of psychopharmacology and more the cultural things. If we want to give it to the client 20 milligrams of any antidepressant medication, we can use a 40 milligrams tablet and give it a half. Works better, for them rather than one. Or if they're similar to medication, like, I don't know, quetiapine 400 milligrams with average dose, could be, and sometimes could be easier to give it the olanzapine 10, with very equivalent, but sounds like the only 10 milligrams versus 400 milligrams. Little things, considerations that could be important. Other things is sometimes the client, for them is important that they are treating for some psych condition, but treated for psychologists, neurologists, but not as psychiatrists. Because psychiatry means like you are having a major problem. Like you are psychotic or something, and they don't want to be in this group. But they can be receive treatment for neurologists, psychologists, because they notice like they can accept it better. Just to mention that sometimes cultural things, the diagnosis of cancer, they have the family sometimes do not address to other people the diagnosis. No, they keep it. no? Rather than mention a grandma who have a diagnosis of cancer, they do not develop that. They said you have they have lung cancer. They say you have a severe bronchitis. You want to have it for a while, and they in the cultural way is very well respected. No, like they have this kind of terminal diagnosis. They shouldn't share with the patient, even though in this culture could be totally different, but in some cultures well accepted. No, even was a movie that I saw years ago about the family, a family from China who uncovered the diagnosis of the grandma. And at the end, and the movie, they mentioned that the grandma, without knowing the diagnosis or so, she left. She was able to live for 8 more years. Doesn't mean that anyone could cancer need to die in the next month. Could be possible, but in that case, and that they wanna imply that sometimes by knowing the diagnosis of cancer, who's many times lethal, sooner or later, is gonna be worse at the very beginning. And the family, as a culture, is the one in charge of giving the support. Next, please. In terms of cultural psychiatry, this is it's so complex. Complex in terms of to understand the cultural psychiatry, we need the help of the anthropology, the social psychiatry, philosophy, so many things. It's not only to speak the language, it's more than that, no? Because sometimes only one word, like nerves for Latino, have a lot of sense. It's only one word, but it's a kind of for people who know the culture understand what it means. For other people, it's only one word. Exactly what do you mean? But when you understand, and we want to discuss this about the ataque de nervios, the nerves, the fright, susto, later. No, but this, in order to understand, to develop the transcultural psychiatry was a work together with anthropologists, philosophy, social psychiatry. Next. There were many work in the early 50s, 60s, and even before in terms of cultural psychiatry, trying to understand. One of the, and the transcultural psychiatry have like a different phases. One is in the 50s, the 30s, 1930, 1950, the 50 to 80, and after 1980 is a kind of more different, even in the year 2010, the DSM-4 changed and make a committee to work in transcultural psychiatry, and explaining many idioms of distress that for other people could be called a pathology, and when you look at it in cultural way, it's not. Okay, next one. Speaking about the anthropologists, Arthur Kleiman, was the director of the anthropology department at Harvard, is the one who do a lot of work in terms of cultural competency, the cultural competency, and they mentioned that basically the, excuse me, the culture is something dynamic. It's something dynamic, that it can be moving a little bit with kids coming here from different countries and assuming this bicultural, be bilingual, bicultural, like many of our clients, the proficiency in English is really good, but also they have the culture. They eat is a Cubans, a Dominican, Puerto Rican. Puerto Rican is a big group, like they're bicultural and bilingual. Puerto Rican speaks English good, they're Americans, but they still keep the culture, no? This is a very important thing. We can, there is different definitions about culture, but one of the shorter and I like it the most, like a culture is life, like a culture is everything, no? It's something like you have it from your family, from home, from your neighborhood, from your town, from your country, from the state, from the whole South America. Like it's very common with little difference sometimes, but it's something not that represent. Like there's some the Latino cultures, Asian and different Haitian in different places. Next, please. Dr. Kreplin is a German psychiatrist, no? Who he wanted to, this is the one when in the early 90s, no? Wanted to get interest in transcultural psychiatry, no? In transcultural psychiatry, no? And he went to Asia, specifically he went to areas of Indonesia or so, no? But he have his ideas, no, about mental illness in Germany. I'm gonna to know a little bit more how is in other places. He assumed initially his hypothesis this was something different. People in other places in poor countries when underdeveloped country was sometimes were seen for some people is a primitive, no, but he went there. And after a study, people who were in asylum, like a kind of like now is a psych wards, so they will put them together. He said that in general, the mental disorders are the same with a little variation, but in general, the core, the 90% of the presentation is more so the same. No? There were other studies that you need to remember also that so many people or other was a paper published by endorsed by the World Psychiatric Association, the World Psychiatric Association for a British psychiatrist who worked he did some job in Kenya, no? His hypothesis was initially he saw that the presentation for depression was a little different, like they were not so somatic or so sad, like in other parts of the world, according to him, no? And at that time, no, probably assuming that they are more underdeveloped or they are in different level than the white people. In the 50s, he wrote a paper to say that the main reason why the depression was different in Africans is because they have underdeveloped frontal lobe. And for that reason, they cannot express too much emotions. You know, that was a paper was endorsed by the World Psychiatric Association and published, and then, you know, then was added to different books and people were learning about this. Then there's so much criticism about this and it was discontinued, this kind of knowledge. But you know, there is this coming from, no, where we don't know or we make sometimes assumptions from the very beginning. Next, please. I put it on purpose, these pictures, to know something is a chemical structure, no? If it's a chemical structure, sounds like a very scientific, something like something serious, no? Next one. The picture, I put it in the past, this is from the psychedelics, no? From psilocybin, ayahuasca with this, no? If I mention this picture only people say, what is that? Sounds like a not scientific. And if they presented it 20 years ago, 10 years ago, or 30 years ago, sounds like a satanic or demoniac rituals. No? Next, please. But it's basically to mention about the rituals about the ayahuasca. Ayahuasca is a psychedelic brew that they use for some rituals in South America, even in Mexico and in different places. No, this is back, they say, to 1,000 years, no, before Christ. No, Western civilization. No, it's very common in the forest, in the Amazon area for Peru, Ecuador, Brazil. Now it's more, they have at this time more scientific evidence, and recently it's got been a lot of research about psilocybin for treatment of depression, anxiety, and also along with therapy, because they said the word they use is suppress the superego, but basically the filter, the superego is less, and people can express her trauma, her problem much easier. No, ayahuasca is very similar to psilocybin, is dimethyltryptamine. No, is dimethyltryptamine. No, and they works the same than psilocybin to be working through the serotonin receptor, because the chemical structures of serotonin and the tryptamine and psilocybin is very similar. No, but this is very ancient now. It's used more in modern religion in Brazil and different places. And I mentioned this because these rituals, like people can say primitive or so, if we look for this 40 years ago and the way they do it, now there is so important, no? So current. No, there is a lot of paper about psychedelic. There is a potentially use in the next years as a treatment in modern psychiatry. Next. No, the people who do the idea is to the ayahuasca ceremony is the opportunity to receive treatment from the spirit. No, and it's part of they call the healing. No, the ceremony basically is at night. No, started at 6 p.m. or so. When they start taking the treatment in the middle of the jungle, it's really dark. They can hear the birds and animals. No, and it's done for these people called the healers or curanderos. Okay, they prepare the so many. You check on internet. There is a ayahuasca retreat. It's around now. It's like $10,000 or so. They go to Peru, Ecuador, Brazil, other places. I don't know if they do in the United States now too. No, and they basically is the ceremony and also the taking the ayahuasca. No, the brew of the ayahuasca, the psychedelic. No, basically for the psilocybin, LSD, from the same family. No, there is the important thing is also the ceremony, not only the ayahuasca, the drug, but the ceremony, something called the set and setting. So that the idea, people go thinking they want to be cured, they want to be clean, they want to do something. All the rituals, the fumes and stuff, the healers, all this, no? Plus the changes induced by the psychedelics induce changes, and people feel improved in anxiety, depression, and others, and potential other treatments in psychiatry. Next. Basically, it's like this. You see somebody, it's somebody from the region or somebody from this is the curandero. Sometimes they ask people to dress in white to be clean and purified. This is the brew from the ayahuasca. It contains the psychedelics. Next one. No, and they prepare, people are here in the middle of the night with fumes or so. I mentioned this because this is now people pay attention and now And they believe in this because they can see the potential use, like a psilocybin, that now becomes scientific. No, but 40 years ago, they can see they're doing primitive stuff. No, and people from South America, other people, they was away. People don't go to psychiatry. So there is no psychiatrist, there is no psychology in certain places. They are the psychiatrists, they are the doctors, they cure, no, so many things. And one of the being things that people have faith on them. No, they believe in them. They believe they can be cured by them. Next one. No, this is a ritual, and they have rituals too. No, they blowing the ayahuasca also. After taking and the head of people. Next. One thing's important, I want to go a little faster with certain things because we know there need too much explanation about the stigma. Especially with the migrants, there is a big stigma in terms of mental health. No, that could be a self-stigma, could be institutional stigma, no, and be a social and public stigma. I am from Peru, and I heard in the news 5 years ago or so, that it was one of the politicians who lost was applying to be a president, and for very small margin from 49.9 to 50.1 lost the presidency. So the news was saying the candidate was not in the news for a few days. People say, oh, probably she was depressed, no? And she went out and said, the news are saying I'm depressed. I'm not depressed. I'm not a weak person. Depression is for weakness, for weak people. I am not a weak person. I am strong, or so stuff like this, no? So then days after came out and tell she was sorry about what she said, no? But basically the idea about this, no? This is the one who was about to be the president and was having this kind of knowledge. That person was the daughter of the President Fujimori from Peru. Studied here in Boston University, no? But even though can be studied here, but the culture, like I said, culture of life, she brought these ideas from home, from the country, from the region, from the continent, no? Just some, next one, please. Another things in terms of stigmas, in terms of the family, no? So many times the family disagree with certain especially depression. If depression becomes very symptomatic, like you don't have desire to do anything, you feel tired, fatigue. Sometimes they have the opposite. Rather than having insomnia, they have a hypersomnia, so sleeping the whole day. So if you are sleeping the whole day, you're lazy, you don't want to work. If you are so sad and you're a man, go to a party or a couple of beers and you want to improve. Things like this. So there's a big denial of this, no? Or people say, I have the same thing, the same problems, and I didn't take any medications. No, things like this. There is more stigma, even though it has been changed. It's changing a little bit, but still. No, I remember years ago, a friend of mine who is a doctor told me, you have a lot of depression in the United States. No, we are busy with a lot of patients. We don't have much depression in Peru. Really? No. The thing is, there is no diagnosis. The way they present the problem is more in somatization. And sometimes it cannot be a follow-up because the diagnosis, people go for a stomachache, headaches or so, and they give you another diagnosis. And sometimes you receive it lorazepam, sertraline, but the diagnosis is not depression. Next one. This is another thing regarding religion and mental health. Religion have a big impact on in the people thinking in the culture and mental health. No, mental health sometimes, and I want to present another slide later, is things mental health health is a spiritual rather than a medical condition. Sometimes you don't have faith, you don't pray so much, you're not going to church so often, you didn't visited your brother or something, so God punished you, something like this. No? So many things is without praying, people go. One of the reasons I became psychiatrist because they do the presentation, I was working in a community for 30,000 people, and close to the clinic I found it was a church, no? And the priest was a very nice guy, but from Minnesota. He was in the 40s or so, a little more, and he was bipolar one, and sometimes become a hypomanic all the time, and manic at times. No, and he couldn't have time to listen to people. Or when they listened, some people was sure, and his answer was pray to the Virgin Mary, please, pray. No, and or sometimes they send it to me. No, and I start listening to them. Sometimes they came directly because they said, I was praying, but still I cannot sleep. So stuff like this. No, and the religion have an important thing. And religion, mentally, sometimes I remember in the Bible, there is during the gospel, I think from one of the John or Matthew, they said like Jesus take out the demon of a group of people, no, who have everybody was having, according to the demons inside, and Jesus take the demon from them, pass it to the folks who were there, no, and then they were cured, and they wanted to go with Jesus to go, and he said, no, stay. So when people see you like you were possessed, now they can have faith and they can believe in my miracles, stuff like this. So there is a lot of things. There is, even in you hear on Sundays during Mass, that sometimes when people were blind or any issues, people said, asking to Jesus, who was the sinner? The person or the parents? Why he is blind? Why he have this? Stuff like this. No, so it's very related to spiritual things, to religion in that way. No, that is the reason we need to understand this connection. Next. Also, in terms of faith and religion, it's not like a bad thing. So it's like it is what it is, but we can use it in the right way too. No, it's the way we grew up. I grew up this with all this, but it's a matter of education to the people to use these tools and put it in our therapies, in our treatments. No, like if you say, doctor, I need to pray more. If you want to pray more, do it, but please take this medication. You come to see me. No, stuff like this. No, so I don't go and say it makes no sense because it's something intrinsic. They believe in that. So the idea is like, how can I use this? No, it was this is very interesting. This was an study, a research doing in Latino population. They do a question with preguntas con cartas, no? They do presented cards with some questions, no? And they discuss later, no? Basically about the mental health and religion or so, no? One of the questions is if a person prays more, they could be cured of the mental illness. Almost half of the participants, 44, agreed or strongly agreed. The praying have an important role in improving from depression, anxiety, or any issues. No. somebody is, this is a comment for a female, 29 years old Dominican, say, some people battle with depression or sadness or anxiety over a problem, but Christians feel we can battle negative sentiments with our faith, with prayer, and with the Bible. No, so the importance of this. No, another one, the one study from this group, no, saying that having more faith in God, for some people, can help to cure the depression. Okay, so it's very immersed. So it's important, like if we consider this and how can apply it later in the treatment, like I want to mention. Next one, please. So there is just this basically in this part in the bottom, in terms of depression and taboo, there is something very common in Latin Americans. Depression is not well seen, no? Okay, or people, it's hard to say I have depression. Somebody can volunteer, say I have hypertension, high cholesterol, but say I was seeing the psychiatrist or anyone for depression. Basically not. No, it's seen by the primary care. They should not seen, just giving medication sometimes. No, and it's at least even at this time as a kind of this taboo. And speaking about, you asked for suicidal histories and the family, for you don't find anything, no, because they were told like grandpa or someone fell from the second floor. They don't say they jump and they want to kill themselves. No, they want to do it. When you go to the church, they said like commit suicide is a big sin. No. Next. Next one, please. I explained already a little bit of this. Basically, I want to run a little bit because of the time. I want to get to the end. Culture is so complex, and we can put in more elements. You know, language, tradition, ethnicity, behavior, belief, history, tradition, so many things. Next one. The idioms of distress. Idiom of distress is Mark Nietzsche is the one who coined these terms. Is more started by the anthropologists. No, is something. Idiom of distress is a kind of symptoms or syndromes who is basically particular for a region, country, or area. From this group belong ataque de nervios, LATA, buffet delirant from Haitian, LATA from Malaysians, susto for South American. Next one. This, I want to mention briefly about this voodoo from who started in in Africa. No, there is in Africa, in Western Africa, where the place like especially the European who colonized the Portuguese, the British brought these people to America. No, there was a specific area in the Western Africa that the French colonies brought people to Haiti. No, and there's a big group who believe voodoo, and I try to mention that because with the therapies in here, we have a patient who were called to see him like a month ago or so, or a little more, that she was at night in the group home, she was a kind of yelling and screaming, no, at night. And one of the things is when we saw in the office, she was a kind of relaxed or so, basically to explain what happened. She said that she was at home and she felt like something moved in her room, in the table, no? And she assumed that the ex-boyfriend was not good for her. He was a little exerted some domestic violence toward her, and this guy died years ago. Her spirit came that night. So, and she was yelling a kind of, I see you are here. Okay, go, don't stay, but loud, no? Because she was a little scared. No, and the group home call, like she was talking to herself, like she was not doing well. But if we put it in this context, we understand basically what was going on. No, something for her, something was moving the table, and she assumed the spirit of this guy came. And she was raised, she was born in Haiti. Their parents are from Haiti, and the grandparents probably from Africa. No, just basically to understand so many things. Next. Next, please. This is I'm gonna pass because of the time. Regarding attack of the nervous. Attack of the nervous is basically one of the things that in Latino population basically and other cultures too is the presence of the somatic symptoms. People don't go and say, I feel depressed, I have sad, because they see it as a weakness to see this. But basically they say, I have stomach issues. Everything I eat, I cannot digest well. I have pain here, pain there. I have nausea. I don't have appetite. I cannot sleep well. I don't want to go out. Stuff like this. Symptoms of depression, but basically with emphasis in my heart, my stomach, my pain, headaches. No, it's important to know that because somatization is not like it's immature psychological things. It's not for in cultural things. No, that somebody come directly and say, I feel depressed, I feel down. This is the presentation, and we want to see over and over with all the mostly Latino, Central America, in South America. This is the presentations. Next. Another one is the evil eye. People believe like if someone is have see you with intention or not, but according to them, they have a strong energy, can pass it some bad energy. It's basically with the little kids, not with some adults, but with the little kids, and they assume this bad energy is passed to the kids, no, and they have their own treatment. Next. The symptoms are basically for the kids, they cannot sleep, they're crying a lot, the appetite change. Right after, if somebody visited, no, and was watching the new baby or something, and after that the baby have look like irritated or so many things, they usually believe the evil eye, and those are the symptoms, no? Not sleeping, crying, basically. And the treatment is basically with the egg. The eggs is 100% protein, have some electrical charges, and they pass it to the body and they read it. I'm gonna put a picture of this. Next one, please. Next one. So this basically the treatment is a ritual, no? The eggs is a symbol of life, no? It's related to the absorption of energy, and they pass toward the body and start praying, no, and rub it this, and that creates some changes in the energy in the proteins in the body, in the eggs, sorry, and they put it in a glass of water with a little salt, and they start reading, no? It's more symbolism. And somebody say, okay, I see this and that. Next one, I think I have a picture about this. So they pass it, this, and they were praying. Those are the kind of healers or people who in the community, they consider there are people who could do it. And all people who are not doing well in business or whatever, they go for this. And after that, they said improve. Next one. So basically it's like this, no? They put this and they call these changes in the white part of this, no, they can indicate this. In this case, in the middle, on the top, they have something they call evil eye. For them, is something like it is an eye. This is something rounded, no? And with praying, you need to go for this treatment like a daily, early in the morning, and sometimes people improve. They use an eggs who need to be warm at room temperature. Next. Another one is a kind of a susto, no, who is a frightened. It's more so the same with the same thing, very symptomatic. Fever, diarrhea, loss of appetite, restlessness, insomnia, mental confusion, apathy, and all these symptoms. No, is also for this group are susto, nervios, and ataques de nervio, who are very common. And this one more time, this expression, susto, one word, fright, nervous, nerves, no? Nerve attack. There is people in the cultural ways have a big meaning. It's not only one word. It's not only one thing. Next one. I want to go quickly with this clinical case. We have a little time. I give a little time for questions. This is a case like I did almost 28 years ago when I was doing a fellowship I did a 2-year fellowship in medicine and psychiatry. Was a see patient with HIV. No, this is a 50 years old Latina woman for Dominican with on treatment for HIV positive, on treatment for 4 years with antiretroviral medications. She was having the diagnosis of generalized anxiety disorder, panic disorder, PTSD, major depression, and the main problem was recurring suicidal ideations. No, the patient was Catholic, where in Dominican Republic I have 4 grown children. She married very young, used to be at home and raised the kids, have history of domestic violence, and the husband was a drinker and very violent and abusive toward her. At age 45 or so, when the kids were grown, and because this guy was so abusive all the time, she decided to leave her family, no, the kids who were already grown. She went to Puerto Rico with the idea to work over there and bring the kids and also move everybody to the United States. No, she went for a new life in Puerto Rico. In Puerto Rico, she left like 5 years or so. She started a romantic relationship with a man. Puerto Rico, the relationship for 3 years. Then she moved to New York. No, she didn't have any other sexual partners than the husband and this guy from Puerto Rico. No history of abuse of alcohol, IV drugs, or nicotine. And the way I met was in the HIV clinic because she was found HIV positive accidentally through a routine test before a gallbladder surgery. Next. No, so she was a big shock for her. Being positive, she went just for gallbladder surgery. No, she was on stone. She was scheduled for the surgery, and then she was told she was HIV positive. She started treating with antiretroviral medication. The CD4, the main marker for HIV are CD4 and the viral load. No, the viral load, even though she was on medication, was no zero or negative. No, was a little above normal. No, should be below undetectable, but she was detectable. And the CD4 count, good numbers are around above 500, but she was between 200 and 300. No need to give her more medication, no opportunistic diseases, but she was having a recurrent panic attack, suicidal ideation, nightmares, and the depression do not improve much. Next. Basically, the idea is when you are in the treatment is like the CD4 count, because it's HIV autoimmune system. With the treatment, the CD4 count, the defense of the body need to go up, and the viral load need to be undetectable. Next one, this is should be like this, but it wasn't. No, I wanna next one, please. Basically, the idea is when you're in treatment, when you are HIV positive, you have too much viral load, and then with treatment, you become a kind of undetectable. And this is so important because if the immune system is not good, there is so much impact in medical and psychiatric system. Next one. So she was treated in the biopsychosocial and cultural way, no? So I deal with her, I continued the HIV medication and the treatment for depression, but I started psychotherapy with her in weekly basis, and at the end, bi-weekly. She was doing bi-weekly sessions initially, and she was sent under my care because she was on treatment in psychotherapy for almost 3 years, and she always continues suicidal. So I decided to see initially weekly, bi-weekly, and trying to see in the cultural way. First of all, she was Dominican, so we spoke in Spanish. No, the main problem was suicidal ideations. She always believed that God punished her because she became a bad woman, left the family, left the husband, and because falling in love, God punished her and sent the HIV. Next. So with the treatment, something like I treat in a cultural way. So one of the main issues was the guiltiness. God punished her. She needed to continue being depressed and suicidal because was her only way to pay for her big mistake to be with another man in another country. No, so like I mentioned this, I use these religion ideas, the spirituality of faith, no, and said, and we discuss little by little about this, no, like she left because was kind of too much. She fell in love, like everybody fell in love with someone, but the other person didn't mention about her condition. Apparently, she didn't look like so sick or so, but he was positive, no? And we start working in these cultural things, no? She wanted to pray, but she said she was not able to do it because she didn't feel confident that God can listen to her. I said, I think God many times said he can for everybody. No, so I was reading the Bible a little bit because she was Catholic and she knew it in the past. So I was using all these considerations, no, and little by little. And sometimes I make a little joke, she start laughing and then retract a little bit because she couldn't even laugh. I said, you will do it. There's so many reasons people got sick, no? Even they said, I mentioned this baby who have immune system, and it's not, they were born like this, and there is nothing wrong with this. So little by little, in a gentle way, in the cultural way, in Spanish, taking in consideration the culture, taking in consideration the reason why she left, and how she was able to get the plan to move to the United States, to get the citizenship, to bring the kids. No, all this, and little by little, she was improving. No, and to make the story short and to finish this, I can say this picture, like you see here, was more so like this. No, her viral load became undetectable, and the CD4 count went to 900. Okay, and I presented this in one conference years ago, because one of the first cases that was able to present how psychotherapy well done, or psychotherapy done in a cultural way or so, can improve like medication was able to do it. The medication could do it, but sometimes we need a little help. It's like, I don't know, the tide or the watch or something like we use in order to look better or something like this. No, by the therapy, because I didn't do any change with the medication, the same medication for depression, the same antiretrovirals, but after 6 months, the CD4 count became high that she never had in 5 years and become super normal. Okay, so I want to leave it like this, just to say like we need to use this is idiom of stress, cultural bound, the culture to treat our clients, to do psychopharmacology, no, to do everything with our clients, and also to help us with this translation for Haiti and the voodoo to understand sometimes the paranoias or what is in the mental, in the mind of our people. So I want to stop here in case you guys have any questions. Thank you so much.
Thank you so much, Dr. Candamaran. For anyone who does have a question, please enter it into the chat feature or raise your virtual hand, unmute yourself, just ask away. While we are waiting for questions to come in, thank you so much for your presentation. I actually wanted to offer a comment about somatization. In fact, it has been a very long time since I've thought about my own dissertation, but this was a topic of my dissertation. I'll just put the abstract in the chat box. But I had looked at cross-cultural comparisons between Chinese populations and a population in the US. And what I did was I looked at two samples in China. One was a psychiatric sample and one was non-psychiatric general population students. And I looked at the CESD, which has multiple subscales for a somatic factor, an affective factor, and an interpersonal factor. And the theory is that if some cultures tend to somatize more, then the somatic factor would be higher in both psychiatric students compared to the US population. But that's actually not what we found. We actually found that somatic factor was high only in the Chinese psychiatric population, but not in the student non-depressed general population, or I don't know if they were non-depressed, but they were general population, which means that it's not the culture. It could be an individual factor, but it could also be a function of the available resources, the healthcare resources. That if you're in a culture in which psychiatric care is not as widely available, whereas medical care is more available, and there are secondary reinforcements for saying that you have a medical illness, then of course it makes sense to endorse more somatic symptoms relative to affective and interpersonal. But when you're not in a situation where you are necessarily help-seeking, as the Chinese general population, then the affective symptoms was actually more highly rated. So I thought that was interesting in the context of what you're presenting. We do have some questions now. One is, how can we differentiate between hallucinations and calling connection from a higher power?
Yeah, this is a very, very important question. And actually, I had a case when I started my residency, and they called me because this patient was diagnosed as schizophrenia paranoid, in New York. And when I talked to the client, I think it's, the person was having so many problems, so many issues, was new in New York City, who is so overwhelming for this person, and was having a lot of thoughts. And the thought became a kind of, we need to do a good clarification when some people think about their thought sounds sometimes like a voice, like they're talking, They say, or the way they express it, God is talking to me like it's gonna be like this. And people assuming like they hear voices. Sometimes they can hear this. It's like it's in my mind. When I said so many people, we are repeating. I don't forget to go to the post office today for the IRS or so. And we can repeat it. And for other people could be like a crazy, but you try to remember, and say it. But we need to see the context, Is somebody who is fixed, who is so the content of the hallucinations too, Because it could be a voice. There's people also who have hypnagogic or hypnopompic hallucinations at the time of sleep. They wake up and see scenes or they hear stuff. So we need to, it's hard to differentiate initially, but it's in the history. If it's something new, you have more often this, what is behind this, the content of this clearly voice or not, and what is the content? This is my comment.
Thank you so much. I think we're at time. Thank you everyone for joining us today, and especially Dr. Candamaran.
Thank you.
you.
Thank you, Children. Thank you, Lola. Thank you, everybody. Bye-bye.
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 Thank you.